Hello, and welcome to another rendition of How to Survive Healthcare. I'm Kayla Thompson-Riviere, your host, registered nurse turned independent patient advocate, here to talk to you today about superbugs. Now, of course, as with every episode that I do, this is never intended to be a substitute for medical advice, but merely for educational and entertainment purposes only. So, superbugs, what are they? What do they mean for you? So superbug is a term that refers to antibiotic resistant bacteria. So these are bacteria that through human antibiotic use have now become stronger and more difficult to treat. This is a problem because it results in more significant illnesses and unfortunately more fatalities than from those illnesses for the people affected by them, particularly those who are immunocompromised at baseline and are including our cancer patients. So it is estimated by the National Institutes of Health that more than 23,000 people are killed by these superbugs every year. Not a small number. So it's really important that we all work together to do what we can to help slow down the spread and creation of superbugs. So how does this happen? Superbugs are directly caused by the overuse of antibiotics. When you take an antibiotic, it doesn't just kill the bacteria that you're taking it for. So let's say you have a sinus infection. When you take the pill or you get that IV, it doesn't laser target the bacteria causing that sinus infection. It actually wipes out a whole plethora of bacteria within your body. You may have noticed this before. A lot of people have had antibiotics and then ended up having some bowel issues. And that's because there's a lot of bacteria in your gut that are actually needed for digestion. So what happens then is all of these other bacteria get wiped out, ones that were good or just indifferent to your body. And the ones that get left behind, the ones that were stronger than that antibiotic, they now have a clear playing field and they can just go crazy and proliferate. So you get these bacteria that were resistant to the antibiotic are now rapidly multiplying, and you can easily spread them to other people. After you spread them, they may not cause an infection at that time, but it's very interesting. They can actually communicate with other bacteria and share that information, that whatever it was that helped them to not be killed by that bacteria. So you can see very easily how quickly these bacteria can become more and more resistant to the types of drugs that we have. This is why it is so important that antibiotics are used actually rather judiciously and not just prescribed at any time for every slight concern, because this negative sequence of events occurs every time we need the antibiotics, and it's sort of an unintentional consequence of that very needed drug. But then you can think, if we're using antibiotics and it's not even appropriate, we're not even receiving benefit, but we're creating all of this harm. There's some common ones that you've probably heard of, like MRSA or MRSA, VRE, and C. diff. These are some of the biggest, most well-known superbugs that are incredibly difficult to treat. They infect hundreds of thousands of people every year. The MRSA alone is responsible for 11,000 of those deaths every year. It's a big one. So what can we do about it? So there's a few things. First of all, when you're in your home setting, you actually, again, unless you have some sort of underlying immune condition already, or you've been advised otherwise by your doctor, you want to keep your environment clean, not necessarily sanitized. So let's talk about the difference between those things. So cleaning is what normal soap and water does with your hands. So you get your hands wet, you lather up with soap. The soap actually removes all of the germs off of your skin and you wash them away with the water. You're not actually killing germs, you're just removing them from the surface so that they're no longer in the environment and causing a problem. It's the same way that we should be cleaning our countertops and floors and stuff like that. The reason we want to avoid sanitizing in the home setting is that most bacteria that live in your home are what's called opportunistic bacteria. So they don't, in the average healthy person, they don't actually, if you ingest them, they don't cause a problem. They're such a small, minute issue that your immune system has no trouble, knocking them out. And they really don't cause infections. Again, with the exception of the already immunocompromised population. But what happens is if you use sanitizing agents instead of just cleaning practices, the sanitizer actually has to be used for a very specific length of time. For instance, a lot of people use Lysol, and I believe Lysol actually needs to stay wet on the counter for a minimum of 2 or it might be 3 minutes. I'd have to look at a bottle. But what you see a lot of times is that people will spray the countertops and then immediately wipe it. So the wiping action is cleaning the surface. It removes the bacteria, but any bacteria that get left behind, they weren't exposed to a high enough level of concentration of that sanitizer to actually be killed. So really, when it's exposed to that low level, it actually kind of trains them and teaches them how to adapt to that sanitizer. So when you started off with bacteria that didn't cause a problem, and then through this low-level sanitization practice, you can actually create superbugs. So that is why inside your home, you keep your hands clean, your counters clean, keep your environment clean, but not necessarily sanitized. We typically don't recommend buying. A lot of times you can see them in the stores now. It got really popular with COVID. Soaps that contain antibacterial components in them. Those really should only be reserved for healthcare settings where the concentration of those superbugs is so high. It tends to be more than what's necessary in the home setting. And then again, you can inadvertently create more superbugs. Now, on that note, I mentioned about the healthcare setting. It's a whole different beast. So there is a popular misconception that hospitals are really clean places. And it's funny, they're kind of clean, but not clean at the same time. So while it's true that hospitals get cleaned more frequently and with higher grade sanitization than your home does, it's also a huge concentration of very sick people with very bad germs. Not always superbugs, but guess what? The ones who get superbugs infections, they get even more sick than like a regular infection and they end up in the hospital. So you have a very large concentration of those very difficult to kill bacteria in this place. That, in addition to a recent study indicated that only about 60% of hospital rooms are actually cleaned properly. Again, think about that wet time. The same thing can happen in the hospitals where surfaces get wiped down, but they don't actually stay wet long enough for that sanitizing agent to do its job. And then again, the bacteria that get left behind are the superbugs, or they're becoming superbugs because they're learning how to adapt. So while they are cleaned frequently, just all of those factors combined, you really can't consider them to be a clean place. Your home is typically much cleaner than a hospital room. In addition to that, not only do you have this high concentration of ill people in a small space, but then you have the healthcare workers that actually go from room to room. And with any improper sanitizing procedures, they didn't wash their hands or use the sanitizer, or they're moving about the room with gloves on that perhaps they didn't change in between activities, you can very easily get a spread of germs. So much so that the CDC actually estimates that 1.7 million infections occur every year in US hospitals from the hospitalization itself. So it's very important that if you or a loved one are in the hospital, that you take some measures to protect yourself against getting a hospital-acquired infection. So one of the big things is asking for your environment to be kept clean. Surfaces, like especially the bedside table or the bed rails, often are forgotten about in cleaning. When housekeeping does come in and there's patients in the room, a lot of times they're not going to do a whole full clean like between patient turnovers. So again, if any bacteria is introduced in the room, or even your own bacteria from like toileting and whatnot, it can just easily get spread around and end up in your system. So don't be afraid to ask your nurse or your aide to wipe down, especially like your overbed table where they put your meal trays, so that you can limit how much of that bacteria is in your environment and potentially getting into you. Also, don't be afraid if you see a healthcare worker that perhaps they were helping you with toileting and then now they're helping you get set up for a meal and they didn't change their gloves in between, please say something. It's very commonplace that people put on gloves and then, their hands are kept clean, but the surface of the glove isn't clean. So it can be very commonplace for people to forget the need to be changing gloves. Another little trick I want to share, I know an advocate actually who does this, where if she has a patient in the hospital, she brings in a bag of Twizzlers. And any healthcare provider that walks into the room, she offers them Twizzlers, but says, oh, you have to, use the hand sanitizer first. So it is a little bit of a trick or a ploy, but it does achieve the result of making sure everybody who's coming in the room is compliant in hand hygiene and keeping your environment safe. In addition to that, make sure you're keeping up with your own hand hygiene. I know that, being in a hospital bed, you're not always able to get up to use the bathroom and to wash your hands like you normally would. So having your own bottle of hand sanitizer at the bedside will be very helpful for you with that. My last pet peeve I want to note is I have seen this over and over again. Gentlemen, please, if you are using a urinal, don't put it on your bedside table where they put your meal trays. Drives me crazy. I know it's not always possible to have that urinal, collected and emptied exactly at the time that you go. But typically they have like a little handle and you can hang it on the bed rail. It's still not ideal, but better than being on the place where you actually eat. And then again, when these items are put down, when somebody does come to empty it, just please ask them to wipe down those surfaces so we can stop that spread of infection. The last thing that you can do to help protect yourself and everyone else from superbugs is practicing what's called good antibiotic stewardship. So what does that mean? So as I mentioned before, antibiotics have these negative consequences when we use them. But even moreover, a large percentage of the time when we use them, they're not even really necessary. There's a lot of people who get ill and go to the doctor, whether it be their primary care or the walk-in clinic, and they expect to get something from the doctor. It's very frustrating to go to the doctor and not get anything, not get a prescription, just sorry, I hope you feel better soon. But the thing is, a lot of infections are caused by viruses and not bacteria. And when we take an antibiotic in those settings, just in case, or perhaps because the doctor was pressured into giving you something, you get all of those negative consequences of the antibiotics, again, in your body and contributing to the overall issue of superbugs and for no benefit. So it's really not in your best interest to do that. Make sure that when you are seeing your provider when you're sick, that you're being very open about sharing what symptoms you're having so that they can differentiate between bacterial or viral, and if antibiotics actually are the most appropriate choice for you at that time. In addition to that, if you are prescribed antibiotics, please, it's very important that you take the entire full course of antibiotics. A lot of people will stop taking them when they start feeling better. But what happens then is, just like how I was talking about how the countertops not staying wet for the full time makes bacteria stronger, it's the same thing with the antibiotics. So the ones that should have been killed by that antibiotic, say it was 14 days of antibiotics and you stopped at day 10 because you were starting to feel better. Well, you didn't kill quite all of them. And then the ones that survived have learned how to survive. And then that antibiotic is not going to be as effective next time. Lastly, on that note, of course, the very most important thing you can do, an ounce of prevention is worth a pound of cure, my friends. So do what you can to stay healthy in the first place. Drink your water, eat your vegetables, take your vitamins and your medication, and keep yourself, your immune system up so that when you do encounter something, it's not going to knock you down quite as bad. And you can limit the amount that you need medical intervention in the first place. So that goes with a lot of things, but especially when talking about over antibiotic use, it's always important to mention. So I hope this was helpful for you today. You learned something more about superbugs and what you can do about them. If you have any questions, please don't hesitate to reach out. And always, if there's something that you'd like to hear me cover in the podcast, let me know. I'd love to hear from you. You can get a hold of me right on the website, herdforlife.com, or through social media. Thank you. Have a great day.